Many people across the United States suffer from ulcers. Now, in the stomach and small intestine, that's where ulcers mainly occur. In the stomach, it's called a gastric ulcer, and in the small intestine, it's called a duodenal ulcer. Now, one reason why ulcer disease affects a lot of people in the United States is because the cause of them are usually self-inflicted. Non-steroidal anti-inflammatory drugs, or NSAIDs, are a major cause of ulcer disease in the United States. So we're talking about things like aspirin, ibuprofen, Aleve, and then you've got a whole bunch of different medicines that, if you look at the fine print, they've got aspirin in them, or they have ibuprofen, but it may be a cold remedy that has an NSAID in it. Now, the risk of having a ulcer from an NSAID is usually about 15 to 20% for developing that. And of those, about 11% are going to have a bleed or a perforation, either in the stomach or the small intestine. So the typical symptoms of an ulcer would be pain. We call it the epigastrium. It's just right where you would say your stomach is below your breastbone. Other symptoms of ulcer disease would be that you would have pain after eating. That's a gastric ulcer. Pain gets relieved with eating, that's a duodenal ulcer. And then if you have things like black stools or you're throwing up blood, it's important to see your gastroenterologist because you may have an ulcer. They're easily treated with medications as long as you don't develop a complication.